Hi, my name is Barañano. I'm a physician with Retina Specialty Institute. I wanted to tell you a little bit about myself. I grew up here on the Gulf Coast in Mobile, and I was fortunate to be surrounded by a community of family, friends, teachers, and coaches who were very supportive of me during these years. For college, I went to Haverford College, which is a small liberal arts school outside Philadelphia, where I majored in Spanish. I then got my master's in Spanish through Middlebury College while I was living in Spain. However, I knew I wanted to be a physician, so I went to medical school at Johns Hopkins University School of Medicine in Baltimore, and I was thrilled to attend this school. It was very wonderful training. Then I went on to do my training in ophthalmology and vitreoretinal surgery at Doheny Eye Institute at the University of Southern California, Los Angeles. After I completed my training, I was looking forward to returning to the Gulf Coast, and I'm thrilled to join Retina Specialty Institute in 2013. In high school, I accompanied my father, who's also an ophthalmologist, on a medical mission trip to Guatemala, and I returned to work in a clinic there in college, and this is when I knew I wanted to become a physician. In medical school, on the very first day of the rotation in ophthalmology, I was just absolutely fascinated with the eye, its beauty, its organization, and its function. During medical school, we observed our mentors in the clinic taking care of patients and performing intricate surgeries in the operating room, and I really saw the tremendous impact that ophthalmologists can have on their patients' lives. I enjoy the challenges and the delicate nature of ophthalmology and retinal surgery. I enjoy being able to see patients of all ages in my clinic, but most of all, I find it incredibly rewarding to have an impact on my patients' lives by either improving their vision or protecting it. The doctor-patient relationship is the most important and special part of medicine. I really strive to form an active partnership with my patients. My staff and I understand that when patients come to a retina clinic, they're often scared or unsure of what to expect, and so we really try to put them at ease. After the exam, I explain all of my findings to them. I educate the patient and their family on their disease, and then we go through the treatment plan. I tell them what they can expect. I also tell them what things that they can do at home to protect their vision. I'm very proud of my staff because they do a wonderful job of taking care of our patients and really helping them out through this process. I find that it's also critical to communicate openly with other physicians taking care of the patient. There's many systemic diseases like high blood pressure and diabetes that can affect the eyes, and it's important to have an open line of communication with the other doctors that take care of that patient so their overall health is protected. As a retina surgeon, I take care of very common retinal diseases such as diabetic retinopathy, macular degeneration, macular holes, and retinal detachments. It's very rewarding to be able to either protect my patient's vision or restore it after taking care of one of these problems. I also see a lot of patients with something called uveitis, which means that there's inflammation inside the eye. There's many causes of uveitis, and one of the more challenging things for managing this disease is figuring out that cause. Often it can be caused by diseases outside of the eye, systemic problems such as rheumatoid arthritis or sarcoidosis. And so I find that it's very helpful to communicate with the other physicians, such as internal medicine doctors or rheumatologists, so that we can work together to protect not only the patient's health of their eye, but their overall health. It's not uncommon that as ophthalmologists, we're some of the first ones to diagnose these diseases. If we can get the appropriate treatment, then we can help try to prevent further complications to the rest of the body. We're living in a very exciting and fortunate time here in retina. There's new medications that have been developed that help protect vision loss from people with what used to be considered devastating eye disease, such as macular degeneration and advanced diabetic retinopathy. We also combine this medication with advances in imaging technology, and this has really revolutionized the way that we take care of our retina patients. However, there's still work to be done. Retina Specialty Institute and myself are very involved in clinical trials that help develop new medications as well as new drug delivery systems so that we can continue to advance the field of medicine. First and foremost, I enjoy the time that I spend with my patients. Some of them we see quite frequently for their treatments, and so they become like friends and almost like family for myself and my staff. I'm very proud of my staff and the way that they truly care for these patients, and we do our best to make sure that they're being taken care of. All of the physicians at Retina Specialty Institute, we're all very committed to providing the best quality we can for our patients with compassion and kindness.